Hello, everyone. Thank you so much for joining us today. We're going to get started here in a minute. My name is Megan Milcharek. I am the head of education and assessment for Enflux, Academic Intelligence for Student Success. And I am here with Ashley Castleberry from University of Texas at Austin College of Pharmacy. She is really the star of the show today. I am just here to make sure that things get clicked in the correct order and questions get answered in a timely manner.
Yeah, thanks for being with us today. It's going to be a fun conversation. So excited to engage with the audience.
Yeah, I always love a chance to get to spend some time with you, Ashley. I mean, I wish it was face to face, but we can't always have what we want. So, just some housekeeping notes as we're getting started here. Everybody except for Ashley and myself is muted right now. Please use the Zoom webinar question and answer field at any time to send questions or feedback for myself or any questions that you might have for Ashley. The webinar recording is absolutely going to be available afterwards. So if you have to run for another meeting or somebody knocks on your office door at that in the middle of the webinar and you need to take it, go ahead. You'll be sure to get this afterwards. And then, as we're waiting, right in the chat, what institution do you represent? What are the main data challenges that your institution faces? And then, how do you currently approach accreditation compliance? Lots of questions for a little webinar chat. So feel free to pick one and answer that. Particularly on those main data challenges. Wow, I'm really futzing over my words there this afternoon. So again, your hosts here, myself, head of education and assessment for Enflux, and then Ashley, you have a very long title that I love. It speaks to a great career that you have accumulated throughout time: Assistant Dean for Curriculum and Assessment and Clinical Associate Professor of Pharmacy Practice. How did you get to assessment?
I feel like assessment found me. It was something that I was really interested in when I was getting my master's in education. There were a couple of different tracks that I could choose. And of the three, assessment was the most interesting to me. So I
That's
chose
super
that
cool.
track and then was able to really get to tailor my studies on assessment, both assessment in the smaller sense, a
Mhm.
little a assessment within courses and writing surveys, writing exam items, all the way up to the big A programmatic assessment. So it
Wow.
found me, and I'm so glad that it did because I love it.
Hey, so that's the thing I didn't know about you, that your master's is in education. My master's is
Yes.
also in education. So there's where our Venn diagrams overlap. So I
Yep.
love that. There's a need, I think, it's always great when educators come into healthcare spaces because we bring a little bit of a different flavor to what you guys are doing. But also we end up learning a whole heck of a lot of stuff about healthcare and how it's delivered and also our own health. So it's like a mutually beneficial relationship, I feel like, personally and professionally. More of us need to
Agreed.
get into it. All right, so today our aim here is to cover process change, significant process change that helps us to improve assessment practices, implementing data management practices, discussion of accreditation changes. We know accreditation changes are coming. And if you do know anything about Ashley, you do know that she's rather involved in the profession, in the accrediting bodies work, and just a mover and shaker in the world of assessment, really with her finger on the pulse of what is changing in the accreditation standards and how academic programs can really prepare and keep up with those constant changes. And then, really the success stories, the things that Ashley and her team have been able to do at UT Austin to make sure that they are able to save time and get streamlined data management and analysis. So again, super happy to see you all here. We've got people coming from Colorado, California, Utah, ooh, University of Alberta. We even have international participants, Ashley. Yay! They're going
Hi,
international.
Ken.
I can. All right, so we're going to talk a little bit about what we call the boring stuff, or at least people outside of assessment call the boring stuff. Policy, procedure, and process are kind of the name of the game for us. If we're doing things in a correct way, in a process that makes sense, we're going to be able to show the outcomes that we need to show. We're going to be able to show the data that we need to show. And so I just pulled this to show that this is across all of our healthcare professions, or at least two of our major healthcare professions that at least we serve at Enflux. ACPE, ARC-PA. So ACPE is for our pharmacy friends. We're very familiar with those standards. and RPA for our friends in physician assistant programs. There are full sections of what we have to respond to in our self-study about just, I mean, looking at our policies and procedures. Ashley, I'm sure you love putting together that big binder of our faculty CVs and resumes, right? Just for them to leaf through.
Absolutely. That's always a fun one to pull together.
Right? When you have to go to your really accomplished senior faculty and say, I'm sorry, but we have a page limit on your CV and you're going to have to cut off some publications, all those things that they just want to leaf through and make sure that we have a policy, a process in place, and then to show the data that the policy and process that we've put into place is successful for our school and our students. Right?
Exactly. I mean, I feel like that's what accreditation is. It's just showing we do have a process in place and sharing that with you, and it's working for us. It doesn't have to be cookie cutter that we're all doing the same thing, but it allows us that time to reflect and make sure it's working. And if not, get it working.
Get it working. And it's the bane of our existence, but it's the thing that gives us the most freedom that we can choose how to do these things, right? And of course, if there's a best practice, we all want to copy it and make it work for our schools, but we really do have that freedom to respond to the accreditation standards in the way that works for us, so long that it works, right? So when it comes to making those changes in assessment, what we're really talking about is process change. We're really talking about a process of going through and agreeing upon that we need to make a change. So recognizing that a change needs to happen and then agreeing that we need to make a change. Sometimes we get hung up there by somebody who says like, no change needed here. I think everything is fine. But that's why we have Enflux. That's why we have data. That's why we have the ability to look and get those insights. Then we develop the strategies to respond to the need, implement the strategies, and reinforce. Sounds so simple, so simple. But Ashley, where would you say, I mean, to me, I can think of where I would typically fall apart in this process. Where do you think the hardest challenge is in a process change?
That is interesting. I think it's number one. I really do think it's recognizing and agreeing that change needs to be made. I think it gets fun when then you start to develop the strategies and implement and then monitor the change. But I think sometimes we just get stuck on number one. And
Yes.
then if I can give a close second, it's the last one. We get going, we get working, we implement strategies, but we forget to then start the loop over again of now is this new strategy working?
Yes. Yes. I remember being at a school where we implemented a course revision, right, for the first time in the history of the school. And we did it one year, and then it came time for the next cycle. And the biggest question was, do we have to do this again? It's like, yes, we have every time. We do it every time. So that reinforcing
Continuous quality
quality
improvement,
improvement.
right?
Yes, absolutely. And I love that you said sometimes it is that recognition, particularly if you have people who are stakeholders over something. It can be really hard for us to see our own thing as needing help, right?
And us too, as assessment people, we love our process or we love that policy. And I think it's sometimes hard for us to change as well.
It can be, yes. I remember even personally having faculty say, I think it's time to go back to the assessment plans and sunset some things off of it. And my first reaction being like, no, we can't. Everything's vital. But then, oh, wait, maybe it's not. Maybe we are doing some things that can fall off of here. So you're right. I think that last stage two, those last two stages, implementing, reinforcing, that reinforcement of making sure that we're constantly doing the thing that we said we were going to change, and we're not sliding back into those habits that got us into the place that we recognize the need for change to begin with. So how do we know then that like everything we've done, we've gone through this whole process change, we've worked with our team, we've been the person sending the emails, we've sat through all the meetings, we've made the process change, we've gotten to a point that we can reinforce it. And how do we know that it was successful? Well, it should solve the problem, right? We shouldn't see the problem again. So just like clinically, if you have an ear infection and you take an antibiotic, how do we know it worked? The ear infection went away and you got better. So whatever the process that was flawed should be fixed. And then it should stand up to that repeated testing, which means it needs to be measurable. It shouldn't be based on the vibes, the gut feelings of people, a conversation that happens in a hallway. It should be demonstrable with proof, right? So that's where I say, Ashley, for those of us who are PhDs and assessors, it matches perfectly with the scientific process that we learned, right? It is that constant
So
going back,
true.
right? It needs to hold up. It needs to be repeatable. It needs to be measurable. And I mean, we could go off on a tangent of how many articles get retracted because things weren't measurable, things weren't repeatable in the data. But, we're not looking for peer-reviewed journals here, but we are looking for peer review within our own school. That's what a self-study is, a little bit of peer review for ourselves. So did we solve the problems we identified? Are they still solved? Can we measure them? And then the big one, I think, for all of us is, does it save, ideally, perfect solution, does all of these things, and then also saves time, money, and stress? I think stress is probably what's top of mind to those of us personally. I don't know about you, Ashley, but certainly since 2020, 2021, it feels like we have been on the stress merry-go-round, if you will.
Yeah, we've been doing more with less, and that has been hard. And I think we're all feeling that as that's built up, like you mentioned, over the last few years.
Absolutely. And then along with that, the concerns, we don't like to think of higher ed as a money-driven institution, but it is, right? We still need to have money in order to be able to serve our students in the best way and put our programs together the way that we like. So saving money is always going to be top of mind as administrators, even as faculty and staff. We have to be thinking about, are we doing things efficiently so that we're using all the resources we have in the best way? All right. So roadblocks and barriers. We have to talk about those roadblocks and barriers because they exist. So what gets in the way of all that process change? Well, Ashley, you mentioned it, conflicting priorities, right? Conflicting priorities. Has that been something you've faced? I mean, you're in a large system school, a school that's large in a large system. I have to imagine that's been a constant thing.
Yeah, I feel like balancing resources and all of the needs and really ranking those to priorities is something that's always top of mind in any program. And it's certainly some during the accreditation process, you're maybe more readily or easily looking at all of those priorities that you have and having that time to reflect. I do appreciate that about the accreditation process, that it does force you to pause
Yes.
and step back. Why are we doing what we're doing? Are our priorities where we want them to be? And so, even though it's a hard process, it is
Hmm.
still a needed process to sit back and reflect.
Absolutely. The other thing for me has always been uncertainty and ambiguity that can be internal and external. If you're ever going through any sort of changes in leadership, whether that be within your school or within your entire university, that can lead to some of those internal and external feelings of uncertainty. If you don't know what the accreditation standards are going to look like in a year, that can lead to uncertainty and ambiguity. Thankfully, in pharmacy, they bring us in early and often to talk about changes and make us aware. I mean, I came to work for Enflux, and before I did, I remember responding to several different surveys and focus groups about the new ACPE accreditation standards being released next year.
Yeah.
Yeah, so
We
I
should get
remember.
to see them, or at least the final version, here in a couple of months. So I think that's really exciting. But you're right. I think that's a wonderful thing in pharmacy that we do get to give some input, and it is a long process so that lots of people can get involved. I don't think that that is a luxury that everyone shares,
I
but I'm
think you're
thankful
right.
that we do.
Yes, very much so. And then lack of documentation, unclear expectations can get in the way. We're looking to make things better, but without, what makes it better, what qualifies success can always be difficult. You feel like you're aiming for a target in the dark. Territory marking or siloing, like we talked about earlier, if you're somebody who owns something and somebody else comes along and says, hey, we need to change this, it's not as efficient or working as well as we think, you can get some of that like, ooh, mine, maybe don't. Or I don't know if you've experienced this, hopefully not at UT Austin, but any sort of like siloing where departments maybe don't get along as well because of historical, political stuff, right? Like those things really do happen. You end up carrying water for something 15, 20 years ago, and you don't even know it. And then other processes, inefficient existing processes, I should say. Ashley, I shared with you when we were preparing this that I worked with a school where, and this was at the university level, thankfully not within the school I was working in, The university curriculum committee accepted a proposal at the beginning of the meeting and at the end of the meeting that were in conflict with each other. And it wasn't recognized until after the meeting had happened, which made for more inefficiencies because of how often the committee met. I'm sure you face some inefficient processes across time. Yeah.
Yes, and I feel like we create them, looking back, it's like, "Oh, I did that to myself."
I thought
So,
that was gonna be good, and it wasn't so
yeah.
good. Yeah. Um,
But part of assessment people, we see it's not working, we make a change, we monitor that change and just start the process over again. So I think flexibility and, not getting too attached to any of our processes is
yeah.
important, and it's something that we love about assessment.
Right? Whether you wrote it or not, don't get too personally connected to it, right? So all of that is what to me leads to when we get that question from the accreditors or even from our university, can I see your data? It's a flight response. Like everybody like little mice takes off in different directions. Or worse, they all turn and look at you at the table. They're like, Ashley? You're like, wait, I don't own everything. I can't possibly own everything. So we get that flight response. And then we have a hard time pulling all the data together. If anybody's ever gone through an accreditation self-study process where you had to chase people down, where you really had to pull things out of them, this should feel uncomfortable for you as I'm talking right now because I'm seeing you, right? You know that feeling. You know that feeling. So we want to make sure that you don't have that feeling, right? It's process change, it's making sure your policies are in order, and then it's making sure you have a place to come in and check that you have implemented your process and policy changes to an effective degree. So case study, that would be you, Ashley. You're a case study now. Although I feel like at this point, you're like a longitudinal case study with us, nice and long across time. So we've gone through that lovely title that you have before, clinical associate professor and assistant dean for curriculum and assessment. In your role at Austin, are you an N of one, or do you have a team that you're working with in assessment? Tell us a little bit about your school and your role there.
Yeah, I'm lucky to be a part of a team and leading a wonderful team. So we are in the accreditation process right now. So we definitely are feeling all of that. But a little bit more about my team. I have a director of assessment. So that is wonderful. We get to bounce ideas off of each other and really work together as a team. We have someone who oversees our day-to-day exam soft everything.
Mm.
So, posting of exams and helping faculty to analyze all those statistics, getting faculty to tag their questions as we are about to talk about. And he has actually become an expert in Influx as well, as we have been trying to leverage those platforms together to get the most out of both of them. And then we also have someone who works really with student success and is monitoring students as they progress and helping give them resources like tutoring when they struggle. And so that has been a wonderful team because not only are we on the process side, but we're on that implementation and the student facing
Yes.
side as well to really use the tools that we have, not to just impact curricular change or programmatic improvements, but really all the way down to the student and getting to
Mm.
interface with the students quite a bit. So
I love that.
love the team. It is such a team effort.
Yeah, assessment is best to me when it's close to the students, right? When we focus on why we're doing it, and that's usually for the students. Um, but that's just my personal thing. So, for those of us who are sitting on this call and we're looking at Ashley now with the greenest eyes that we possibly can because she has a team and we don't have a team, it still can be done. You can still do all of the amazing things that Ashley and her team are doing with a team of one, with a team of two, the small team, because you have something, hopefully, or you will have something that will help you do that. So I wasn't involved in the sales process when it came to UT Austin. Thank the good Lord, because I'm not an effective salesperson. Let me guess at some things though that were top of mind when you decided as a school to purchase Enflux. I'm going to go out on a limb and say managing, collecting, and reporting for your self-study.
Oh,
Yeah.
yes,
Yeah.
absolutely.
Your workload, right? Regular administrative work, teaching, advising. I call it 10 pounds of flour in a 5-pound sack throughout your workday.
Absolutely.
Yeah.
Lots to do. And When it comes to assessment, I think it's great. There's been a focus on through the accreditation standards on assessment. And so a lot of our colleges have created positions or, have someone who's now working
Yes.
in assessment. But as those standards continue to expand, that's a lot of work on one or two or a very small group of people. So I like that analogy,
Absolutely
10
is.
pounds in a 5-pound bag.
Yes, it absolutely is. And as somebody who benefited from schools of pharmacy creating those positions, I really thank, again, the profession for doing that because it kept some of us employed and gave us really great spaces to come into. And then, of course, the increasing need to respond to your students, right? Student needs, I think they're growing. I mean, we like to say these days, but we do have the evidence to suggest that our students are coming in dealing with things that they haven't dealt with in the past. We have more working students than ever. We have students who are coming in at different ages. Non-traditional students seem to be going up, right? So we have to respond in a little bit of a different way, and we have to know our students differently. We can't make assumptions that we made maybe 10 years ago about what a class of students looks like anymore.
Yeah,
Um,
and Megan, just coming back to students are the key. This is why we do it. We're not doing this for a fun exercise, and we're not doing it for accreditation either. We're doing it so that we can help students and
right,
that we can equip them and make our programs better to ultimately produce better graduates. And so that's when you think of it through that lens of that's why we assess, that's why we're doing what we do, then the work is not so heavy because
right.
ultimately at the end of the day, it is for the student.
Yeah, and we've talked before, just side notes about how accreditation compliance happens when you're doing the right thing, right? It's easy to comply and meet the standard when you are engaging in the best practices and doing the work that is supposed to be done, right? And whether you're focused on your students or focused on what standard 24 says, if you focus on the students, you'll get standard 24. If you focus on standard 24, you might not get the students. You'll get a lot of policy. So our three main areas of focus today for your case study are your tagging compliance, curriculum surveys, and category performance, right? So those are the three areas that you had identified kind of needed a change in how you were doing things as a process, right?
Yes, this is where we really wanted to be efficient because a lot of these are very labor intensive processes. And so for us, getting Influx was really to increase efficiency, particularly in these areas.
Yes. And they're perfect areas because they're areas that take time to do, like you said, but aren't like the best use of time, right? They're low hanging fruit, as we would call them. All right, so I like this one. I'm a mom, and I know you are too, Ashley. And I'm sure we have other parents on this who are maybe looking at this tag and having a little bit of flashbacks. My son was a taggy blanket person, but tags for kids are soothing. And I like to say that tagging is curricularly soothing. It's how we know our curriculum is meeting what we said it was supposed to meet, how everybody is doing what they're supposed to be doing. And then that we get those outcomes. Are our students learning the things we'd like them to learn? Are we delivering the content in a way that works for those students? So I like to put this up here as just, it's a soothing for us.
Yes, and it is the building block. We are making decisions based upon the data that we are getting
Yes.
back from Influx, ExamSoft, these surveys. And so if we are not tagging correctly, we're not
Yes.
garbage in, garbage out, right?
Right. Exactly. So this is, you had, this isn't your data. I'm going to say that up front. This is not your data because we didn't want to show your data, but you had something similar to what this looked like, right?
Absolutely. So we tag for all of our required courses. We tag to Appendix 1, which is here, the author. We do Bloom's taxonomy. We do disease state as well. And then let's see, what am I missing? I am missing, totally blanking.
ACPE, Appendix One.
Well, Appendix 1 are the didactic topics. So we have all those. Oh, our program learning
Oh,
outcomes,
yeah.
which is
I was
we
going to say
use CAPE
CAPE.
as our
There you go.
program learning outcomes. So those are our 5. So ours looked similar to all of the yellow that we saw at the beginning. Um,
Yes.
and what we used to do, so pre-influx, inside ExamSoft, I had a staff person. It would usually take him 2 or 3 weeks And he would go back over the last semester and make sure that faculty had tagged to all of their questions in required courses to all five of these areas. And
Mhm.
it's not as simple as you think because when you're looking at it, the tags, it's hard to tell if you've got all five tags there.
Yes, it is.
And what we were able to do in 2 or 3 weeks previously, we came in and in a matter of hours, we were able to search by faculty member's name and showed them, here are the item numbers, and here's which one you're missing. Sometimes it was just missing one single item, like you just left off blooms on this one single item. It was
Yes.
obviously an accident, but go back in and you can click here in Influx and go straight into ExamSoft, add the tag that you want. And it was also easy for us to see on disease state in particular. Not all of our courses are required to tag to disease state because they don't have to have a disease state tag
Right.
to them, right? Let's
It's a
just
health
say
and
it's
behaviors.
kinetics, yes, calculations, or even just anatomy and physiology. It's not necessarily a disease state. And so that was our circle, our pie that had the most untagged. And when I first looked at it, I thought, oh no, we've got so
Yeah.
many items that we're missing here. But when we then drilled down and I was able to see, oh, that's coming from our pharmaceutics course. Of course, there's not a disease state tag to that. No problem. I'm just going to skip all of those. And we didn't waste the faculty members' time by saying, you have untagged items, go back, because they had tagged everything else. They were just missing the disease state,
Just
which
missing
was
the disease state.
totally fine. But this allowed us to see what was missing from each one and then reach out to those faculty members individually, give them the item numbers, and then they could see what was the one tag they were missing, or, maybe they missed all of the tags.
Yeah.
But it was super efficient from us, from the assessment office, to be able to do this, sort it by faculty members' names, send it to them in order to make those changes.
Yeah.
And then we could see in real time as they started adjusting, we would just look back again and say, oh, great, faculty member A, they've done what we've asked. And, we can check the next one. So it was super efficient on our end, but it was also really nice for faculty because we weren't just saying, hey, go in on exam one, you've got some that are missing. It was actually by item number
Right.
and the specific tag that they were missing. So it really benefited us in the assessment office, but faculty time as well.
So that's the part about conversations is super fascinating to me, right? Because you said disease state didn't need to be tagged everywhere. I'm wondering if, as you reached out to faculty, because now you had somebody who had a little bit more time, did you start to get questions about just, I'm not sure what tag to put here. I'm not sure if this is the right one. Were you able to give a little bit more of that like educational piece of how to do things?
Absolutely, because of course when we first implemented ExamSoft, we talked through tagging, and when new faculty come in, we talk through it. And at the beginning of the semester, we send out the document of here's a reminder, all of these tags are required. But it is kind of a nice checkpoint to even look in and say, you've tagged all of these at a level, the highest level of blooms. Are these
Right.
actually all at this level? And so it is
Yeah.
nice to, again, be able to kind of step back and reflect and make sure that what we have is accurate before we start running all of the reports. Because this is
Yeah.
foundational. We can't or we shouldn't be running all of these reports for accreditation if these circles are not very, very close to
Right.
100% green,
We
right?
shouldn't be doing it
Because
with any sort of confidence, at least. Yeah.
exactly. So that was our number one goal, is to get these all as close to green as possible, except for disease
Disease
states.
state. Yeah.
hmm
But even
But
that,
then we could do a lot of things after that. But this was foundational.
yeah, I'm just thinking even on disease state, an analysis of, are we doing all of the level ones? Are we doing too many level threes? Are we is cardio all really, really level three and we miss the basic cardiac life support?
True.
It's like, so all of those layers you're able to now unveil and reveal to your faculty and have more conversations about the intention of your curriculum, because the garbage isn't coming in. It's really coming in as clean, beautiful food.
Exactly. So this
Right.
was our first step was tagging.
Yes. Yeah. So then the second was survey analysis. We love our surveys, don't we? In all of our professions, we love our surveys, but just in general in higher ed, my goodness, do we love them. Survey fatigue is real, people. So just a like simple math question for you all. Just give me your best guess. If you had a graduating student survey of 85 questions with about 70 respondents on a 5-point Likert scale that also had 13 multi-select and demographic questions, how long do you think it would take you to like parse, visualize, and analyze this survey on your own?
And we want to hear from y'all. So in
Oh
the
yeah.
chat, what would
Yeah.
this take if you have this spreadsheet of results?
A long
How long
friggin'
would it take
time.
you?
Ken Core with a long friggin' time. Ken, you're right. You're right on the money. A long time. Yeah.
And this is only one survey, right? We've got
One.
graduating, faculty, preceptor, alumni, and those are just our national benchmarking
Yeah.
surveys for pharmacy. That's not to
Yes.
count all of our internal ones.
And
So
this is if we don't add any questions to the GSS survey, right? Because we can add optional questions to these surveys. So way
true.
too long. I mean, I did it. I'm sure you've done it. And it was, if you don't get too bored to walk away and you can sit still and finish it all, it's going to take a day or two, maybe longer.
Yes.
Yeah.
And you're doing this every year whenever the surveys come in, because
Yes.
then, of course, you want to compare to, well, are we better or worse than last year? What about the year before that? Where
Yes.
are we trending? And so
Right.
not only are you focusing on that year, but then you're looking back for the comparisons.
Right.
So,
If you and if you're anything like me, you come to it the next year with the file and you spend about 3 hours looking at it going, what did I do last time?
yes.
Yeah. Even if you have it written down, you're still like, what did I write down? What did I
Yeah, because
do?
you only do it once a year.
Because you only do it once a year. So that was another area of improvement that you noticed for your process change. So again, just, sort of talking us through your process on those quality surveys, which we have just running in the background here.
Yeah, so I love this dashboard with insights because you're able to see where am I different from the national or from my peer? And then that last section there at the bottom is from the previous year. So you can narrow it down and real quickly see, oh, we seem to be better in this area. So that insights dashboard is really nice. And of course, it's going through all of those 4 different surveys that we get from AACP. But the executive summary is my favorite because it is already by standard. So I just click here and say, hey, I am looking down right now at standard 10. Let's see all of the questions that are associated with standard 10. And then I love it here too because we have year over year. So I can look at the most recent year and compare. It gives me those pretty visuals, so I can have my eye drawn to that darker orange, but then I can hover over any of these numbers and get all of those extra details that I may be missing at that first glance. And being able to switch back and forth between percent agreement or the Likert score. Wow, that is a huge time saver, which is literally just a click of the button here. Um, when we bring these data in front of our committees, in front of the faculty, we often use these above and below thresholds because, yes, we want to see the ones where we are below our peers or below the national average because that's where we have some work to do. But we always flip it and say, actually, let's see where we have above 90% agreement. Let's see where we're doing great and really celebrate some of those. Trending is the next tab that I use all of the time because I want to be able to see where are we trending, not just this point of time and these results, but let me look at this specific question and see what do we look like over the last few years. Are we trending better? Like maybe our numbers are still not where we want them, but they're better than last year and the year before that. So we're headed in the right direction. Or vice versa. Maybe our numbers still look good, but we're still trending down even though this point in time is good. I want to get out ahead of that because eventually if that trend continues, then we will be in trouble. And so I love to see those trends. And then demographics is so nice because you're just able to click and then have these wonderful visuals to see who is actually responding. And then that will take us back to see our response rates, which is something that we can find there in that background and just look to see what were our response rates compared to peer and national over the last few years to know how much stake should we put in these results? If our response rates were really low, then we should take that into account when we're looking at responses. So those are some of the favorite pieces that I love when I'm looking at the survey data.
Awesome. And I just wanted to pause here at the in some of these visuals and just say that, in terms of multimodal learning, we, even as faculty and staff, we used to be students and we are still in many ways students. We're always learning. Lifelong learning is what we do. And for me, I always appreciate how anybody who looks at this, whether they are a bar graph person, they need a heat map, they need to see it in text, they need to be able to see the data underneath. It's available for anyone to look at in multiple ways, right? So if they have a way that they prefer to understand this Likert scale versus percent response, it's all available. And we even include, some schools like to exclude, they're unable to comment, they don't want to see them in the results. We have the ability to do that too, to pull out things that where they said NA, and so it doesn't affect your Likert score in that way. So, this ability to look at all of these different measures, but also look at them in a way that works for the director of assessment, the assistant dean of assessment, and also a faculty member who might be new and not really sure what they're looking at, I think is super helpful. It takes some time off of your plate, Ashley, for having to say, well, what a Likert scale is and how you would respond to this is, because you can just flip it over to percentages and talk about it in a way that makes sense to them.
Absolutely. And I, I see Janet's comment there in the chat of it's true, it takes a long time to do this.
Yes.
And it frees up your time to actually focus on what we want to do with the data that are in front of us
Right.
instead of making the graphs and the trends and that takes forever, but
It
you
really
want to
does.
focus your time on, let's look at this item. What can we do to change responses on this item? And that's really where the investment of time should be, not on our spreadsheet.
Not on our spreadsheet, exactly. And so then the final thing that you really were looking at was what are our students, after we've done all this, we've made sure that our tagging is good, we've made sure that we're looking at our surveys from our different stakeholders. Then it comes down to, are our students learning the things we want them to learn, and how are they performing cohort over cohort? So I thought I'd give you a chance to talk about your work in that students and outcomes as well.
I think this is like the most fun is getting in here because again, we've ensured that our tags are correct. So now we can get in and actually play with how students are performing. So looking through this, we can look cohort to cohort to see maybe there's been a change in the curriculum that you've made between those 2 years of students. So what were the results? Did the change actually result in the improvements that you were looking for? So I think looking at those groups across time is really helpful. And you can just keep drilling down to the next level. And that's what this is showing you. Just keep hitting the plus sign, and that drills you down into those details. And then you're able to see specific students who might be struggling in that area. Which is what we have here. I feel like this is so powerful because not only are we saying this is our curriculum map, because we all do that, right? We spend
Yeah, for
time, we
sure.
send out a survey, and we
For
have
sure.
faculty say, yes, I teach this in my class. And maybe we even get it down to the level, like I teach this at a mastery level versus just a practice or an introduction. So we might even have a heat map when it comes to
Hmm.
our curriculum map, but that's just what we say we're doing. What this allowed us to do is now not only am I saying that we are teaching hypertension in
Hmm.
these courses, I can now say we are asking 182 questions on hypertension,
Yep.
and students are scoring at an 87% across those items. Well, now I feel like we've just gotten three-dimensional with our curriculum map. It's not
Right.
just do we teach, do we not teach, or what level are we teaching? It's then what are we assessing? How are we assessing it? And how are students performing? And
Yeah.
it comes to life at that point. And so this students and outcomes has been able to allow us to do that. And we've put our curriculum map up beside, I need a new name for whatever this is. It's a student
Yeah.
performance that then goes along with that. And to me, that's that's where it is.
For
It's not
sure.
just, do we say we're doing this, but how are students actually performing? And so, I'm so excited to show this data to our accreditors when they come in just a few short months, because I think it is so powerful. And that's, again, where we can monitor changes in student performance as we make changes to our curriculum.
Yeah. And then even better, be ahead of the game when it comes to what the accreditors are going to ask, because they ask us for those aggregates at the top levels of our performance categories, our students learning, but then we can answer beyond that down to the individual student. Like, yeah, in aggregate, they are appearing to retain this information across time. But I actually do know of the 3 or 4 or 5 students who are having a hard time doing that, and I'm actively in communication with them through my student success office, through my
Yes.
individual who works with students. So we're able to like even just take that one step further. Accreditation, it's going to happen. We're going to be compliant. We're going to meet it. But then we're going to go beyond that and make sure that our students are being served, which is just going to make that self-study so much easier to do. So much easier to do. Well, I think we're actually getting close. Oh, so the benefits of using Enflux. Of course, I can't not talk about the benefits of using Enflux. So, like you said, identifies those areas of opportunity, your compliance, your outcome performance year over year, your survey analysis, all of it got faster. Your data was ready for analysis. It's in, you click, it's clean, you don't have to spend time. And then you're able to track your insights and action plans. So the next step, and I know Ashley, you guys are working on this next step, you're coming up on this with some of your strategic planning and some of your at-risk student work, and making
Yes.
sure that you're able to communicate through the system directly with the data, provide live view links to say, hey, go back and look for yourself, but here's what I saw. And then also to
Yes.
check and recheck that you've continued your changes and you've been successful in what you've changed.
Yes, action plans are our next step, is to really, now once we identify a change that we want to make, track that within Influx and assign it to people, and then have reminders to come to people, and have that really paper trail of the change, because those who have been through a self-study process, I know you feel me on this, changes have been made, and you might even have some data to go along with it, but you're like, wait, where did that come from? Which
Mhm.
committee originally started this? Like,
Yes.
it's hard to kind of piece back the story.
Mhm.
And this provides, or action plans would provide that paper trail of, hey, we actually made this change because it was in this survey where we had low responses. This person took the first step. This was the change that was made. We're going to look at the data next year. Oh, wow, look,
Look at
survey
that.
responses are better.
Yep.
And so, it's the sticky notes. I think of action plans as sticky notes that we sometimes have all over our office, but it's keeping them in one place so that we can show that story of our change.
Yeah, absolutely. Thank you for that. And I love working with your team as you're getting ready to do some more of those things, and just all of the insights you've found so far and the changes that you've made. The team that you mentioned is really just outstanding, and always grateful to be able to chat with them. So at this point, I think we've, gotten Ashley to tell us kind of everything that she can possibly tell us, unless you have some questions that I didn't ask that you might want to ask her. So we have the Q&A there for you, to ask some questions either of myself or of Ashley, and we'll have that open for you for a little while. We're so thankful that you were here today. Your commentary in the chat was helpful, insightful, and funny. Janet, I'm still laughing about that one. I mean, honestly, I had a very similar conversation with my own dean. I can't be 75 people. I wish I could. They just haven't figured out how to cut me into that many pieces yet and keep me alive. Um, so it's nice to see that we all have those commonalities, that we have a lot of work, and we have been thankful to find something that can help us do that work. So All right, give a couple minutes on the Q&A, but if there are no questions, I'm going to give you all some of the time back. Oh, where we go? I've got a question about nursing. So our tagging would be the essentials, the NONPF competencies, IOM, etc. Yes, I'm going to say those are going to actually dovetail quite nicely probably with what we're talking about in pharmacy, ACPE. Appendix 1 standards are the required didactic content. So anything that the accreditors tell us that we have to put in our program, biostatistics, research design, pharmacotherapeutics, kinetics, medicinal chemistry, medication management systems. I'm like just pulling them all out, right? Right.
Yes, very good.
Yeah, we have
And that
yeah, go ahead.
Oh, sorry, I would just add to that. There's some things that we tag to because they are required, like Megan
Mhm.
mentioned with Appendix 1. We need to do that because our accreditation standards tell us to. But, I would think what would be helpful to your curriculum or to your program that would be really great? It's going above and beyond what's required, but are there some additional things? Like for us, it was disease state. We don't have to do that, but it's really nice to see how students are performing on disease states.
Mhm.
Um, and so maybe it is some sort of curricular change, pre a change, you're going to have some tags, but then after you make those changes, you have some more tags. So
Yeah.
what would be beneficial for your curriculum, but then what's beneficial for your students? Because not only are we looking at all of this data programmatically, we are getting this back into the hands of students. We are releasing
Yes.
report cards back to them so that they can see how am I performing in disease states overall? And so, what is it maybe about your course that would be beneficial for students to receive feedback on, or just overall in your program that you want students to know how they are progressing? Some of our programs will use licensing exam blueprints. We
Yep.
we choose not to. We kind of
Yep.
liked where we were with our 5 that we required, but, maybe that is helpful to students as they prepare for the NCLEX in this situation that you're mapping to maybe the blueprint so that they can get some sort of feedback at the end of your program or as they are progressing onto those licensure exams to be able to help them study. So I would just recommend as you're thinking through and deciding as a faculty, what do you want to tag to? What benefits the program, benefits the curriculum, what benefits the students, and then what's required of you.
Yeah, and so to that, I would just say an example of that. It mentioned disease states. I was at a school where we actually got it anecdotally from students, and that's an okay way to do assessment too, is to gut check and find data to see if things are true or not. So we got some anecdotal evidence from students that suggested there were way too many select all that apply questions, select all that can apply type questions on certain exams. And so you don't always want to say, all right, one student told me a thing, it must absolutely be true, but we actually put a tag for faculty to use when they made select all that apply questions. And we were able from that to actually say, yes, the students are correct. We feel like there is an imbalance of select all that apply questions here. And it turned into a really big conversation and professional development around test blueprinting and test creation and being fair in your assessments. So that can be very specific to your school. And then we had a couple other questions just about what student services are like when a student with needs is identified at your school. And then where and when you look at your exam categories. Is this backside or front side of the assessment or both?
Oh, good question. Let me let me start maybe with that one about categories. So we do try to look before exams because that's when students are going to receive their report card after the exam. So we want those tags to be good for that student feedback, but some slip through the cracks. So we do at the end of each semester look back on just that semester and reach out to faculty. But ideally, the answer is both. But for
If you're
sure,
interdisciplinary, you can sometimes, right, with a course coordinator who really wants to do that. Yeah.
true, true. And then going back to student services, I love this question because they are assessment and student services are so closely linked to each other. The process that we do is when we identify that a student has failed an exam, we reach out to them actually through our Associate Dean of Academic Affairs. So it does get their attention
Of
because they are
course.
receiving an email from her that really has them complete a survey on, what happened. Let us help you kind of think through the process. And this is where
Ooh,
we find some things that I just didn't study until the day before.
metacognition. I love it.
Okay, exactly, it is metacognition, but we also find those things of, I had a death in the family the day before, and we had no idea, but through that survey, we find out, well, life happens outside of
It
our
does.
curriculum,
Hmm.
and so that then allows us to provide different resources than just a generic, "Oh, you failed the exam, study harder," right? So that survey allows us to triage what is happening, and then our Associate Dean of Academic Affairs does reach out to the student and have an individual meeting. Then we're able to tailor resources. So maybe it is tutoring, but
Hmm.
maybe it is some sort of student emergency services that need to be offered or additional resources. So we want to give them the right resources, and that survey helps us to triage and figure out
For
what those
sure.
are. We also do exam reviews afterwards. So the week after the exam, we have on our calendars, it looks like it's a class on their schedule, but it is an exam review time where they look at all of the exams they've taken the week before. So we do a delayed
Oh my
review through
goodness.
ExamSoft, and the students come in. We even have a form, we call it an exam autopsy form, which, oh, I hope that doesn't sound too grim
Oh, I
to
love it.
people, but
Little
an
postmortem.
autopsy, it's a postmortem. It
Mhm.
allows you to look back and think through what went wrong. And so the students come to the review, they see the exam in a secure environment, and then they complete this autopsy form where they identify, okay, I just misread that one. Oof, that was a study error. That was a concept error. And they're able to look through and see, hmm, I made a whole lot of careless errors. And then on the back of the sheet, it says, when you make this error, these are the things you need to do next time to try to prevent that error from happening. You need to slow down. You need to check your answers, read through it again. And so
There's no
it
medal for finishing
allows,
first on an exam.
that's right. So it allows them time to sit with the exam for a bit, process where things might have gone wrong, and then make a plan with some goals before the next exam. So that it's kind of our process from once a student fails an exam, they take that survey, meet with the associate dean. Everyone comes to the exam reviews, but of course, it's highly recommended for those who failed the
Fantastic.
exam to come. And then hopefully that cycle does not repeat and they're able to be successful on their next exam.
Yeah. So,
And yes, I would be happy to share those documents if
yay,
you'll um,
fantastic.
email
I
me
love that.
directly. I'm happy to share.
I super appreciate that. Another version of that that I've done in terms of looking at exams afterwards is meeting with students individually. If you have a process that's like that, maybe a little different. You don't have exam reviews. You have a mentor-mentee relationship where you're reporting to the mentors. Just to give a different strategy there, Ashley,
Yeah,
you're reporting directly to mentors. These dashboards can be super helpful in finding some of those things out that students aren't even aware of. I'm thinking of a student I worked with who, through the use of ExamSoft data and great tagging, we were able to together identify that the student really struggled with test taking anxiety to the point that they weren't able to answer things that were regurgitative, like those lower level that you would think were multiple choice that they could just bang out. But they were actually able to do some of the higher order essays. But their anxiety just kind of got in the way of those lower level skills. And
sure.
we were able to identify that and come up with strategies specific to that student. Take a walk, don't cram the 5 minutes before, don't join the rest of your cohorts in the library as they all gin up anxiety and
Yes.
nervousness. Go get a coffee or a tea, take a walk around campus, do something that rejuvenates you. So sometimes it can be a postmortem on the exam that leads to specific exam related issues, content related issues. But like you said, sometimes it can reveal personal, cognitive learning styles, things that that student has to overcome that have nothing to do with the content and nothing to do with the way that we are teaching the content, just whatever that student needs at the time. So these processes can really help you find all of those things. So, and Ashley, thank you so much for sharing that. And I know you are always happy to chat about assessment and student support because you regularly chat about it with me, and I'm always appreciative of that. So yeah, Ashley is everywhere all the time. I can't wait to see what you're going to do with all these time savings. I'm guessing your list of publications is going to get longer.
I hope so. Yes, there are so many ideas now because we've got the data at our fingertips.
Absolutely. So thanks again. I really do appreciate you being here today. And I appreciate everybody who joined us today and the questions and insights that you asked for. And as Ashley has given you her contact information, you know my contact information. It's Megan at Enflux. Anytime, happy to chat with any of you about what you may be working on or any insights into the Enflux platform. This recording is going out at the end here. And again, thank you so much, Ashley. I hope you have a really great rest of your day and rest of your week. And as the semester wraps up, you have some time to relax and rejuvenate over the summer break.
Absolutely. Hope everyone has a wonderful rest of the day. Thanks for joining us.
Yeah. Bye, everyone.